Welcome to our explainer. Today, we're diving into a concept that honestly sounds like it's straight out of science fiction, but it is changing medicine as we speak. We're talking about fake data and its very, very real impact. Let's get right into it.
Just think about this for a second. What if you could train powerful AI models? You could run any analysis you wanted, collaborate with researchers all over the world, and do all of it without that constant fear of exposing a patient's private information. I mean, that's the incredible promise of something called synthetic health data.
But, and this is a really big but, the reality is so much more complicated. Because as we're about to see, this so-called fake data can end up leaking very real patterns, it can amplify real-world biases, and it can lead you to conclusions that look absolutely right, but are actually dangerously wrong.
Okay, so to really understand this double-edged sword, we first need to get a handle on what synthetic health data actually is.
You know, the core idea is actually pretty simple. It's data that's been artificially generated to mimic the statistical patterns of real patient records. But, and this is the crucial part, it doesn't correspond to any actual living person. Imagine a computer studying a massive real dataset. It learns all the relationships, the correlations, the distributions, everything. And then it uses that knowledge to create brand new, completely artificial records that just look like the real thing.
And let's be really clear about something. This is not the same as anonymization, where you just go in and strip names off real records. And it's not de-identification either, where you just mask certain fields. Both of those methods are still working with the original patient data. Synthetic data, on the other hand, it's built from scratch. It's totally new.
Which, of course, leads to the next big question. If it's totally new, how in the world is this fake data actually made? Let's take a look at the generative process.
So there are basically three main ways to do it. First, you've got statistical models. These just map out the mathematical landscape of the real data and then draw new samples from that map. Second, there are generative adversarial networks, or GANs. Now, this is that cool forger and detective system you might have heard about. One AI tries to create convincing fakes, and another AI tries to spot them. This constant battle forces the forger AI to get incredibly good at capturing all the subtle, complex patterns in the real data. And third, we have diffusion models, which start with just random noise and then gradually, step by step, refine it into ultra-realistic data.
But here's the catch. It doesn't really matter which one of these fancy methods you use. You're always going to run smack into the central challenge of synthetic data, this core tension between two goals that are always fighting each other.
And it really all boils down to this. The more privacy you add, the less useful the data tends to become. You're constantly trying to balance three things: fidelity, which is how real the data looks; utility, which is whether you can get the same analytical results from it; and privacy, making sure it can't be traced back to a real person.
This shows that trade-off perfectly. Look, simpler statistical models, they often produce more useful data with higher fidelity. But the more complex models, they can offer much stronger privacy protection. They often do this by adding something called differential privacy. It's basically a mathematical guarantee that makes it almost impossible to identify any single person in the data. But that guarantee almost always comes at the cost of the data's utility. There is really no free lunch here.
Okay, so given that trade-off, where does this tool actually provide some real, practical value? Where does it help us?
Well, the applications are genuinely powerful. It can unlock AI training when real data is just too restricted to use. For rare diseases where you have very few patients, it can create more data to actually make research possible. It lets different hospitals collaborate without ever having to share actual patient records. And it's absolutely perfect for education, giving students realistic data to work with at literally zero privacy risk.
But, and you knew this was coming, for every single one of those amazing benefits, there is a hidden risk, a failure mode that can be totally invisible until it causes very, very real harm.
A lot can go wrong. A model can accidentally memorize a real patient's data, which would let an attacker figure out if that person was in the original dataset. If your source data has any kind of bias, guess what? The synthetic data will often reproduce it and sometimes even amplify it. You can get this false sense of confidence from a model that works perfectly on the fake data right up until it completely fails in the real world. But, the biggest risk of all? It's just skipping the rigorous privacy evaluation and just assuming the data is safe.
Now, I know this all sounds really complex, but it actually boils down to a pretty clear practical guide for anyone who's thinking about using this technology.
And look, if you remember only one thing from this whole explainer, please make it this. Synthetic data is not a privacy cheat code. It's an incredibly powerful tool for sure, but it's one that demands respect and rigor.
So before you ever trust a synthetic dataset, you need to ask these 3 questions. Number 1, does it actually preserve the key statistical patterns that you need for your work? 2, can you get the same analytical results with it that you would with the real data? And number 3, the one that gets skipped all the time, have you actually tested it for information leaks about real people?
Answering those questions is the absolute key to unlocking the promise of this technology. Ignoring them, well, that means you're taking a risk you might not even see until it's way too late. Because at the end of the day, it's simple. Fake data demands real rigor.
And that's our look at synthetic data. Hey, if you found this breakdown useful, be sure to hit that like button and subscribe. For an audio-only version, just check out the link in the description. And definitely let us know in the comments what complex topics you want us to break down next. Thanks for watching.